Hey guys, hope you all are doing well. Today we are going to discuss about another topic that is Parkinson's disease. So, what is Parkinson's disease? Parkinson's disease is a nerve system disease. So, it will affect our nerve system, neurons, and it is characterized by three major factors. They are tremor, rigidity, and bradykinesia. In the coming slides, we will see clearly what is tremor, what is rigidity, and what is bradykinesia. This disease usually start out slowly and gradually get worsened. So the symptoms will occur slowly, the symptoms will get worsened. So in the first stage and all, we can't identify or others can't notice that the person or the patient is having Parkinson's disease, especially in the early stage. So we will see what is tremor, what is rigidity, and what is bradykinesia. So tremor. Tremor means shaking. Tremor means shaking, jerking movements. Jerking like when we touch in the current, how the body will jerk. That is tremor. Kind of shaking is known as tremor. Shaking usually begins in hands and arms and sometimes in jaw or foot. So first it will begin in the hand. In the hand and in the arm, the shaking will start. In early stages, usually this tremor will feel only one side of your body and gradually it will get worse. It worsens with psychological problems and stress. So once we see that your hand is shaking or you're feeling some difficulty while doing some activities means you'll get stress, you will get some tension, and these psychological problems and stress will increase this tremor. Next symptom is bradykinesia. So what is brady? Brady means decreased. Kinetic means movement. So what is bradykinesia? Decreased movement. So it means slowing down the movement of your body. It occurs due to brain's function slowness in transmitting the instructions to the appropriate part of the body. There is particular area in our brain to transmit the informations for movement, for activities and all. So in that particular area, the nerves are getting damaged means this problem will arise. That means slowing down the movement. In the worst stage, we may even drag our feet as we walk. That is the last stage of this Parkinson's disease. So first stage, we don't feel that much difficulty, but we will feel difficulty while moving your hand, while walking, while doing some activities, while writing, everything. You will feel a slowness. Next thing is rigidity. Rigidity means inability to relax our muscles normally. So with and without our knowledge, we can relax our muscles. But you have rigidity means you cannot relax your muscles normally. And that situations we can feel and we can see in Parkinson's patients. It is caused by the uncontrolled tensing or stiffness of the muscle. It is happening because of stiffness of the muscle. While trying to move, we may experience pain in the affected muscle. That is another characteristic feature. When we are trying to move and there is some stiffness means definitely you may experience pain in the affected muscles. So these are all the major characteristic features of Parkinson's disease. So Parkinson's disease is a nerve system disease and it is characterized by three major factors. They are tremor, rigidity and bradykinesia. So tremor means nothing but shaking. Shaking in the hand, shaking in the foot, shaking in the jaw, shaking in the arm. But first the shaking will start in the hand and arms. Next thing is bradykinesia. Brady, you know the meaning of brady. Brady means decreased. Kinesia means movement. So what is bradykinesia? Decreased movement. Then rigidity, that means stiffness in the muscles, and when you're trying to move the muscles or when you're trying to flex the muscles, you may experience pain also. And while coming to the incidence, 50% more in men comparing to women. So the studies and the researchers are saying that 50% more in men comparing to women and commonly seen after 60 years of the age and older. Basically, or commonly, or usually, we can see this in old age people. That means after 60 age. But 10% of the people will get affected before 60 years also. Okay, so this is the incidence. So it is more common in men comparing to women. So, while coming to the etiology, what does the etiology means? Nerve cell damage or nerve cell death. That is the etiology behind Parkinson's disease, especially in specific areas such as substantia nigra and basal ganglia. These two areas of brain will get affected, and these two areas, nerves or neurons, will get damaged, means that may lead to Parkinsonism. Dopamine, it is a chemical substance which is present in neurons, and this dopamine is responsible for communicating the messages between different areas of our brain. So when the nerve cell will get damaged, this dopamine production will get reduced, or very less amount of dopamine will get produced, and this leads to what? Difficulties in the movement, difficulties in muscle movement, difficulties in performing daily activities, and gradually the major characteristic features will arise in the person such as tremor, rigidity, and bradykinesia. So the loss of dopamine causes the lack of coordination in the movement. So this is one of the major reasons behind Parkinson's disease, or one and only reason, like that only able to nerves are damaged. Another reason is low norepinephrine level. Okay, this is another chemical substance. This is needed for the functioning of the sympathetic nerve system. Okay, so when this chemical substance level is getting low, automatically our activities like digestion, heart rate, blood pressure, and other activities, breathing activities, will get low. Okay, so the loss of norepinephrine causes the non-movement related symptoms of Parkinsonism, such as digestion problem, heart rate, increasing the heart rate, increased BP, breathing problem, etc. And this low norepinephrine level leads to other non-motor symptoms like stiffness, anxiety, dementia, depression. So this kind of symptoms also will arise in the patient when the patient is affected with this nerves are damaged, or the patient is affected with Parkinson's disease. Another major thing which we can see in the patient with Parkinsonism is Lewy body present. Present Lewy bodies. Okay. What is Lewy body means? When we check a Parkinson's disease person's brain X-ray, we can see clumps of a type of protein known as alpha-synuclein or Lewy bodies. The accumulation or excess accumulation of these Lewy bodies can cause a loss or damage of nerve cells. So that is another major thing which we can see in a patient, those who are affected with Parkinsonism. When we check the patient's brain X-ray, we can see clumps of Lewy body, that is a type of protein, and excessive Lewy bodies present in the brain means that is a sign of damage of nerve cells. So nerve cell damage means, of course, Parkinsonism. The other factors are genetic factors and autoimmune condition like rheumatoid arthritis. The patient is having rheumatoid arthritis means, or inflammation of the joints means, there are chances of Parkinsonism in future. And results of many studies conducted in 2017-2018 revealed that there is a strong connection between autoimmune disease and Parkinsonism disease. So researchers and studies and findings are saying that there is a strong connection between autoimmune disease and Parkinsonism disease. Then while coming to the risk factors include trauma and brain injuries. Of course, if you use your common sense, you can understand how this trauma and brain injuries are related to Parkinsonism. If you have any trauma or brain injury means there are chances of nerve damage, there are chances of nerve death. Nerve death may lead to this Parkinsonism. Then inhalation of toxic substances. Studies are saying that excessive inhalation of any kinds of toxic substances can affect the growth and development of nerves, and nerves are damaged, and automatically that may lead to this condition. Then age is another factor. When we get age, your nerve cell will get damaged, nerve cell impairment will happen. There are many psychological and psychiatric conditions are coming as a result of aging. Along with that, Parkinsonism is also a condition. This is only a risk factor, okay, may or may not. Then excessive use of some drugs and medication, that is another risk factor which may lead to, which may or may not, okay, again risk factors are may or may not are the reason behind this condition. And this is an X-ray which shows how a patient is affected with Parkinsonism. Okay, so here you can see red area and blue area. Okay, so this brain scan reveal that the part of the brain that's active. Okay, so active is red and shows most active, and blue is the least activities. Okay, so least activities is blue and more activities is what, active brain. So here you can see how a Parkinson's brain and how a normal brain look like. Okay, so in the normal brain you can see a lot of red colors. In a person with Parkinson's brain you can see a lot of less movement areas, that means blue color. So if you see the brain X-ray, clearly you can see how a normal brain and how a Parkinson's brain. And while coming to the other symptoms, this tremor, rigidity and bradykinesia leads to unsteady walk, spasms or cramps, that means pain, stooped position. Okay, this is stooped position. Hunched over posture. This picture will show you what is stooped position. So the patient will be like this. I mean the person will be like this, like this, like this. It will go. So the stooped position will gradually will occur. Then less facial expressions, speech and vocal changes, monotonous speech. That means the tone of speech will be same. For all emotion, the same tone they will maintain. Then speech becomes slurred or be soft in tone. Then small handwriting, and that is a noticing sign. Okay, so handwriting will get small. Okay, small handwriting and difficult to read sometimes. Depression and anxiety, chewing and swallowing problems, drooling. So these are some other symptoms. Apart from that, some more symptoms we can see like urinary problems, constipation, hallucinations, delusions, loss of smell, fatigue, sleep problems, changes in weight, vision changes, low BP or low blood pressure. So these are some other symptoms apart from these major symptoms, that is tremor, rigidity and bradykinesia. And while coming to the stages, there are different stages we can see. First stage is early stage, second is mid stage. Okay, so early stages will show some minute symptoms. Early symptoms of Parkinsonism disease are usually mild and do not interfere with daily activities. So in early stages, we can't identify that the patient is having this Parkinson's disease because the symptoms will not interfere the daily activities of the patient, and that's what I will tell you, that it is not that much easy to detect in the early stage, and we may feel some fatigue, some general uneasiness or some slight tremor. Okay, and we don't feel that this is the sign of, and we'll never understand also this is the sign of this Parkinsonism in the early stage. Sometimes those who are closely watching you or observing you can notice it. That's it. Next thing is mid stage. In the mid stage, we can see and feel the symptoms like tremor, muscle stiffness, rigidity and movement problems. So in the mid stage, the symptoms is noticeable. We can identify the symptoms. You and others, those who are watching you, can identify the symptoms or notice the symptoms. Main thing in this stage is a fall and balance problem. Main thing is you will fall easily. You will not get a balance and you will easily get fall. But still we can do our daily activities in an independent way, but it will take longer time. That's it. You will do your things your own. You can do your daily activities like brushing, bathing, all the personal hygienic things, then writing, moving, walking, everything you will do, but slowly you will do. Next is mid-late stage. Here, standing and walking are becoming more difficult and we need help to do activities. Your problems will get worse and gradually in the mid-late stage, and in the advanced stage, we require a complete wheelchair to move or something based on the person, depend upon the situation of the patient and health of the patient. Sometimes the patient will go to bedridden stage also, and we may experience hallucination and delusion, like severe stage of Parkinson's. Well, coming to the diagnosis, same like other psychiatric conditions: history collection, mental status examination, physical examination, laboratory test, brain X-ray, computerized tomography or CT scan, and magnetic resonance image or MRI. So these are all the common tests. While doing this test, an experienced psychiatrist or a health professional can easily understand whether the patient is having Parkinsonism and in which stage the patient is. While coming to the management, unfortunately, there is no cure for this condition. So there is no complete treatment for this condition, but medications and other therapy can reduce the severity of the condition. That's it. So what is the role of medications? Means this medication will help the nerve cell to make dopamine. In the first slide itself, I told you dopamine is a chemical substance which helps movement, which helps in activities, which helps to communicate the information or messages from one part of the brain to other part of the brain. So what the medications will do means, medication will help the nerve cell to make dopamine or mimic the effect of dopamine, or blocking an enzyme that break down dopamine, or reducing the symptoms of Parkinson's disease. Reducing the symptoms. Complete cure is impossible. Levodopa, that is a very commonly used or most commonly or one of the very important drug which we are using for Parkinsonism. Levodopa. Levodopa is usually taken with other drug, that is carbidopa, to allow more levodopa to reach the brain. So levodopa will not give alone. Levodopa will add with other drug, that is carbidopa. Carbidopa will always support levodopa to reach the brain in a fastest way. If levodopa dose is too high, that is also a problem. Okay, so if levodopa is too high, that can create a side effect that is called dyskinesiasis. What does dyskinesiasis mean? Dyskinesiasis means an involuntary fluid dancing movement of body. Involuntary fluid dancing movement of the body. Okay, the involuntary movement in the body will develop if you're using or if the dose of levodopa is more. So this is the commonly used medication in Parkinsonism. And apart from that, dopamine agonists to support or increase the effect of dopamine, or it mimic the effect of dopamine in our brain. Though there is no proper amount of dopamine, this dopamine agonists will act like dopamine. Okay, the newer dopamine medications like LEWY, okay, pramipixole, etc. are given as a patch. Side effects include nausea, vomiting, dizziness. So there are a lot of side effects for this dopamine agonist, especially nausea, vomiting, dizziness are the common side effects. Other drugs include catechol or methyltransferase inhibitors and monoamine oxidase inhibitors. So what these drugs are doing means, these drugs block an enzyme that break down dopamine in the brain. So these are all the other drugs which we are using for Parkinson's patients to reduce the symptoms of Parkinsonism. Apart from that, anticholinergics to reduce tremor and muscle stiffness. Commonly used anticholinergics are benzotriptan and trihexypentyl. Then amantadine. It is an antiviral agent and it is useful to reduce the involuntary movement. Then istradifylline to increase the effectiveness of levodopa. So these are all the other drugs or other medication: anticholinergic, amantadine, istradifylline. So these drugs are also using for the treatment of Parkinson's. Well, coming to the surgical management, there are some surgical management we will use in the severe conditions and all. Okay, so that is deep brain stimulation. What is DBS or deep brain stimulation means? Implanting electrodes in the brain to block or change the abnormal activities that causes symptoms. Implanting some electrodes in the brain to block or change the abnormal activities. Then carbidopa, levodopa infusion. That is the other surgical management. That means surgical placement of a feeding tube into the small intestine to give carbidopa, levodopa. This method will helps to infuse stable dosage of carbidopa and levodopa in the levodopa slide I told you, excessive amount of carbidopa or levodopa can create lot of side effects. Okay, dyskinesis can create in the body. So a proper amount of or stable dosage of carbidopa, levodopa need to infuse into the body. So through the surgical incision, okay, the surgical placement of feeding tube into the small intestine will helps to give a stable dosage of carbidopa and levodopa in the body. Apart from that, pallidotomy and thalamotomy. Pallidotomy means destroying a small portion or a part of brain to reduce the involuntary movement. That means tremor, dyskinesis kind of involuntary movement. Then thalamotomy means destroying a small portion of thalamus to reduce the severe tremor of brain or severe tremor of the arms and hands. So these are all the surgical management which we are using for the treatment of this Parkinson's disease. Other management include exercise, eat healthy diet, prevent falls, maintain good quality of sleep. So diet, sleep, exercise. These are all the major things. These three things are playing a major role in the treatment of this Parkinsonism. Proper food, proper exercise, proper sleep. It can reduce tremor, rigidity and all, but there is limitation. But these three things are very important. Some tips to maintain balance. Keep one hand free at all times. So always use one hand. Don't use both hands. Then your balance will get disturbed. Then never carry objects in both hands. One hand, hold somewhere with one hand, take the object. Try to swing both arms from front to back while walking. Consciously lift your feet off the ground when walking. Don't try to walk and accomplish another two tasks at a time. Don't do like if you're healthy and if you don't have any problem while walking, we will do many things. With our knowledge and without our knowledge also we will do many things, many tasks. So please don't try to walk and accomplish another task. We must be very careful, or the people, those who are observing and watching and helping them should helping the Parkinson's patient should inform them, should guide them, should need to teach them. Do not wear rubber or gripping sole shoes. Chances of falls. Move slowly always. And if balance is continuous problem, use walking aids such as a cane, walking stick or a walker till you get balance. So this is about Parkinson's disease. So Parkinson's disease is a nerve system disease characterized by tremor, rigidity and bradykinesia. And it is happening because of nerve cell damage or nerve death. So when the nerve cell get damaged, no proper communication will take place from brain to other part of the body and you will get tremor like shaking. When we touch the current, how you will get jerking? That is tremor. Rigidity and bradykinesia. Gradually, your movement will get slowed down and in the last stage, you will go to the worsen stage. Means you will go to a bedridden stage or complete support you need. So there is, unfortunately, there is no cure for this condition. Take the medications to increase the amount of dopamine and take proper diet, proper sleep, proper exercise. These are all the things we can do and we can use some tips to prevent fall. Hope you understand guys. Thank you.